Hi, my name is Diana, and I'm a nurse practitioner student at Herzing University. Today I'm going to be doing a neurological assessment on my patient, Bryant. Bryant, today we're going to be doing a neurological assessment, okay? I want you to know that everything that we do and say here is confidential, and I want you to be comfortable throughout it all, okay?
Okay.
Bryant, can you please tell me your name and date of birth?
Bryant Martinez, 6/6/1991.
Okay, perfect, Bryant. And then have you ever had a neurological assessment done?
I have not.
Okay, all right, Bryant. What about an eye exam? When's the last time you got an eye exam done?
About 10 years ago.
10 years ago, okay. So for your age group, Bryant, they recommend an eye exam every 2 to 3 years, depending on whether or not you have any issues or anything, then sooner than 2 and 3 years.
Okay.
Okay. All right, Bryant. So for the neurological assessment, I'm going to be asking you questions, doing different assessments on you, and I'm going to have you sitting, standing, and laying down. Is that okay?
Yes.
Okay, perfect. So if you don't feel comfortable, you just let me know.
Okay.
Okay, so to begin with, we're going to go over the cranial nerves. Cranial nerves 1 through 12, and for each of them we'll do couple different things, okay? So for the first one, it's olfactory, and for our olfactory, we'll be checking smell. So for this one, I got 2 different smells that I'm going to have you first close your eyes, and then cover one nostril with your hand, and then tell me what you smell.
Lavender.
Okay, perfect. All right, Bryant. So we'll do the opposite nostril, and then tell me what you smell.
Alcohol.
Okay, perfect, Bryant. Thank you. So for cranial nerve number 2 is optic, and for optic, we're checking your vision, okay? So for this one, do you wear glasses, Bryant?
No, I don't.
Okay. Okay, so for this one, we're going to be using the Snellen eye chart. So for this one, I'll have you stand for me, please. And then I'm going to have this one stand 10 feet away from you. So I've pre-measured, so you can stand there. And then I will come a little bit further over here. And then, Bryant, I'm going to have you read this line. Cover one eye for me. And then I'm going to have you read this line right here.
Okay. PECFD.
Okay, perfect. How about this line over here?
EDFZZP.
Okay, what about this line right here?
FELOPZD.
Okay, so how about this line right here?
DEFPOTEC.
Okay, perfect, Bryant. So then for that eye, we are at 20/20. So then can you please cover the opposite eye for me?
Yes.
And then we'll start over here. Read this line for me.
DEFPOTEC.
Perfect. How about this line right here?
LEFODPCT.
Okay, perfect. So 20/20, Bryant. That's very good. And then you said you don't wear glasses, no contacts?
No.
Okay, perfect. So for cranial nerve number 3, 3, 4, and 5 we can actually check together. So it's ocular motor, trochlear, and abducis. Okay, so for this one I'm going to be checking your eye movement and your pupil reflex. So with a light, I'm going to be shining it into each eye. Okay, so then just look straight forward for me. Okay, so Perla intact, perfect. Thank you, Bryant. And I'm also going to be having you've probably seen this one before. You're going to follow my finger, okay? So don't move your head. You're just going to follow my finger with your eyes. Okay, very good. Thank you, Bryant. So for cranial nerve number 6, it's going to be trigeminal. For this one, I'm going to be checking your facial sensation, okay? Okay, so please close your eyes for me. And then tell me if you can feel this and where you can feel it.
My forehead. My cheek. My chin.
Okay, and was that soft? You can open your eyes now. Was that soft or sharp? Soft? Okay, perfect. Thank you, Bryant. So for cranial nerve number 7, it's going to be facial. We're going to be checking your facial nerves, okay? So first, I'm going to be checking for facial symmetry. I'm going to be at rest, looking at the level of your eyes, the level of your ears, making sure that everything is symmetric. So for this one, I want you to raise your eyebrows for me, like you're surprised. Okay, perfect. Thank you. How about close your eyes tight? Squeeze tight. Okay, very good, Bryant. How about smile? Can you smile for me? Okay, very good. Okay. Okay, very good. How about blow out your cheeks? Blow out your cheeks for me. Okay, very good. For cranial nerve number 8 is vestibulocochlear. So for this one, I'm going to be checking your hearing and your balance, okay? So for this one, I'm going to whisper a number on one ear and then make a little noise on the other, and then you're going to tell me what you hear, okay?
8, 7.
Okay, perfect. So if I suspected hearing loss, then I would do the Weber and Rhine. Another exam that you can do if any suspected hearing loss is present. So for cranial nerve number 9 and 10, glossopharyngeal and vagus, I can do those two together, and we're going to be checking your throat sensation and your swallowing. So for this one, I want you to say ah, stick your tongue and say ah. Okay, perfect. Okay, very good. So now for cranial nerve number 11, we're going to be checking accessory, and for this one, I'm going to be checking your neck movement. Okay, so against resistance on my hand, I want you to move your head towards my hand. Okay, perfect. Now the opposite. Okay, no, I'm going to put resistance, and I want you to shrug your shoulders. Okay, perfect. So cranial nerve number 11, accessory intact. For cranial nerve number 12, we're going to be doing hypoglossal. And for this one, I'm going to be checking your tongue movement, okay? So I want you to stick your tongue out, and then move it side to side. Okay, perfect. Perfect, good. So all 12 cranial nerves are intact. Which is very good, okay? So I'm going to be doing a couple other little assessments on you, okay? So for this one, it's going to be familiar objects. I have my objects here. So I want you to close your eyes, and I'm going to put an object in your hand, and I want you to tell me what you think it is, okay?
A key. Quarter.
Okay, perfect, thank you. Okay, familiar object, very good. Okay, so now I'm gonna draw a little figure on the palm of your hand, and I want you to tell me what you think it is, okay? Close your eyes, please.
An 8. A letter S.
Okay, perfect, very good. Okay, Bryant. For my next one, I'm gonna be touching your different parts of your body, and I want you to tell me if you think it is soft or if it's painful, okay? So please close your eyes.
Soft. Painful.
Sharp?
Sharp. Soft. Soft. Sharp.
Okay, good, Ryan. So I'll do kind of the same thing, but just with my hands, and I want you to tell me which body part I'm touching, okay? Close your eyes.
My arm. My forearm. My shoulder. My shoulder.
Okay, very good. So now we're going to do also another thing called 2-point discrimination. So for this one, I want you to tell me if there is one end or two ends touching you, okay? So close your eyes for me.
One end.
Sure.
Two ends. Two. That's one.
Okay, perfect, right? So for this next one, I'm going to be assessing your gait, okay? So the way that you walk. So I'm going to stand over here, and then I want you to walk towards me, okay?
Okay.
Can you stand and walk towards me?
Yeah.
Okay, perfect. And then can you walk back for me? Okay, very good, Brian. You can continue to stand. Oh, sorry, stand for me, please. So for this one, I'm going to be doing the Romberg test. And for the Romberg test, I want you to put your feet together, and then eyes closed, and then with your hands, put your hands towards the sides. Oh, you can towards the sides, yep, just like that. And I'm going to be looking for any type of sway, seeing if there's any swaying present. Okay, perfect. So like that, I want you to stay in that same position with your hands fanned out. I'm going to have you touch the tip of your nose with one hand, and then with your other hand. Okay, perfect. Okay, very good. Right, you're free to sit. So those are good. I was assessing your gait. Okay. So for the next exam, I'll have you lay down. Can you lay down for me?
Yeah.
So next, I'm going to be checking your deep tendon reflexes. checking patellar, Achilles, very good. Bicep and tricep. Okay, another one. Bronchial. Okay, perfect, Brian. So I'm going to also be checking your plantar reflex. We want this to be negative, okay? So from heel. Okay, perfect, very good. You had the correct reaction. So now I'm also going to be having check your cerebellar function. So for this one, I am going to ask you to, with one leg on the opposite leg, do the heel of your foot from knee to shin. Can you rub that for me?
Yeah.
Back and forth. Very good. And can we do the opposite one?
Yeah.
Very good, Brian. Thank you. I'm also going to be checking for ankle clonus, okay? And we don't want to see any present. So dorsiflect the foot. And once we let go, relax, relax, relax. Okay, good. Okay, very good. Thank you. Thank you. And also, let me check sensory. Brian, can you tell me if I am touching you and what part I am touching?
My toe. My toe.
Okay, perfect. Let me know, can you feel the same sensation on both sides?
Yes, I can.
Okay, no difference on each side?
No.
How about this one?
Same.
Touching on both sides?
Mm-hmm.
Okay, perfect. So I'm going to be also be checking abdominal reflexes. Is it okay if I lift your shirt up a little?
Yes.
Okay, perfect. Thank you. Checking for abdominal reflexes. Okay, very good, Brian. Thank you. Okay, you can sit back down for me. Thank you. All right, Brian. I think we've gotten through everything. And once again, I want you to know that everything is confidential. Your name, date of birth, and everything. And I know I asked you a couple questions at the beginning, like if you knew what day it was and what year and the presidents. I also wanted to check a little further back. Do you remember what you did yesterday?
Yesterday, yeah, I went to work out, hang out with some friends.
Yeah.
And then went to my brother's birthday party.
Okay, perfect. Have you ever had any issues with memory or remembering what you were doing or where you were at or anything like that?
No, I have not.
Okay. I haven't had any surgeries that affected your brain, never hit your head, any concussions or anything like that?
No.
No? Okay. All right, perfect. Well, that concludes our assessment. Do you have any questions or comments or concerns you'd like to ask me?
No, I don't.
No? Okay. All right, perfect.